In 2011 through 2012, a study conducted by Policy Surveillance Program and CDC staff concluded that 6.4 million U.S. children ages 4 to 17 have been diagnosed with ADHD. Many of these children have fallen victim to the use of ADHD medicine. Attention deficit hyperactivity disorder is a neurological disorder that affects one's behavior. In most cases, the detection of this disorder starts in school, when the child's behavior starts to affect their learning. The symptoms of this disorder normally include fidgeting, not sitting still, misbehaving, and having trouble paying attention. These symptoms can be shown all at once or singularly, known as ADD. As the child ages, there are more serious concerns like depression and anxiety that come into effect. Doctors haven't found a reason for this disorder, but some people claim it's too much TV and others think it's due to too much sugar. The best solution is to allow a professional to dictate whether it is a serious threat or a simple issue that can be solved through behavioral therapy. Most people with this disorder have a difficult time managing their attentiveness or energy, and sometimes both. There are 3 types of ADHD issues: inattentiveness, hyperactivity, and a combination of both. If this disorder is not treated, one's behavior may never be helped and will follow into adulthood. Most signs of ADHD may be internal, such as short-term memory and losing track of time. Although these are actions most people relate to, the difference is these actions greatly affect the individual's daily life. The most popular and effective medicine for people with ADHD include Ritalin and Adderall. Both of these drugs have a huge effect on the brain. According to Ken Livingston, Ritalin and other drugs change the brain's neurotransmitter speed by balancing out the transfer of electrochemicals, resulting in quicker synapses. Livingston also added these electrical chemical processes must occur at the right levels of intensity and in the right patterns for the mind to function effectively. In recent years, there have been a huge spike in teenagers and even college students taking Adderall. Although a person may not be diagnosed with these conditions, the brain functions more effectively. The leading reason why children are on ADHD medicine is due to the lack of options provided for parents to take. Parents get highly concerned when their child's teacher confronts them about the child's behavioral issues in class and their dropping grades in school. The teacher and parents are not doctors, but conclude that the child has an attention problem and consult a doctor to fix the problem as soon as possible. Usually, the doctor prescribes medications for the child before any further analysis is made. In an article written by Montina Ghosh in 2016, he states it affects more than 7% of children, with higher prevalence among boys. Girls normally don't get detected due to the lack of hyperactivity, and even less percentage of girls and minorities get treated. In most cases, lesser-income families don't take their children to get psychologically analyzed because they are uninformed or ignorant of the issues. These families think that unless it's a serious case, the child will eventually grow out of it. The first step is to identify the child's problem, like hyperactivity. Then, a professional evaluation by multiple doctors in the field. And finally, professional help. While some parents think their child has certain behaviors, it is more important to seek professional help before closing the discussion. They need to analyze the child's actions before assuming they are misbehaving. Others should be asked about it because they are likely to know more details, such as their teacher, friends, and family. ADHD should be treated quickly before it takes a toll on the mental health of a child. ADHD shows no signs of progression through age, but can harm one's life as more responsibility is added. Ghosh also describes what people with this disorder have to go through. Experiences include lack of concentration, unable to remain seated, difficulties waking up in the morning, organizing tasks and working with coworkers. There are all kinds of signs to tell whether a child can have ADHD. Parents should take time to look through the behavioral signs before disregarding behavior or medicating a child that has no need. The signs are usually observed by others around the child and are easy to spot. Overall, parents should consult a professional before giving the final diagnosis, and it could save a child.